Did you know that 1 in every 8 men will face prostate cancer at some point in their lifetime? And each year, this silent disease takes the lives of more than 30,000 American men. The scariest part isn't just the numbers, it's the fact that prostate cancer often causes no pain, no obvious symptoms, and by the time it's detected, it may already be too late. But here's the truth few people tell you. Prostate cancer can be detected early, and if you know how to recognize the warning signs, you could save your own life or the life of someone you love. Think of your body like a clock. Before the hands fall out of sync, it often makes unusual ticking sounds. If you listen closely, you'll notice and have the chance to fix it in time. Prostate cancer works the same way. There are always quiet knocks at the door that most men overlook. According to the National Institutes of Health, NIH, prostate cancer is the most common cancer among men and the second leading cause of cancer-related death. That sounds frightening, but here's the good news. You can lower your risk and increase your chances of survival by learning to recognize these early warning signs. In today's video, I'm going to share with you 12 early signs of prostate cancer that most people tend to miss. They may seem small, even easy to confuse with just getting older, but in reality, these signals are extremely important. If you pay attention in time, they could mean the difference between staying healthy and losing the chance for treatment. Stay with me until the end of this video, because even one of these signs could completely change the way you see your health. This isn't just information, it's an opportunity to protect yourself and your family. Sign 12, blood in the urine. Imagine this. One morning you walk into the bathroom, just like any other day. But when you look down, you notice your urine has a pink, red, or even brownish tint. The first reaction is often worry, but many people quickly brush it off, telling themselves, maybe it's from eating beets or just a minor infection. It'll go away in a few days. That very sense of reassurance causes many men to overlook one of the most important warning signs of prostate cancer. The presence of blood in the urine is called hematuria. In some cases, the blood can be seen with the naked eye, while other times it can only be detected through a lab test. At any level, this is not a sign you should ignore. It's true that hematuria can be linked to other issues like urinary tract infections, kidney stones, or bladder inflammation. But for men over 40, especially those over 50, it may be a warning that the prostate is in serious trouble, ranging from enlargement to cancer. The danger lies in this. When a tumor grows inside the prostate, it can rupture tiny blood vessels, allowing blood to leak into the urine. And once this symptom shows up, the disease is often already at a concerning stage. That's why you should never try to self-diagnose or simply wait, hoping it will go away on its own. Sign number 11, difficulty urinating or feeling that the bladder isn't empty. Have you ever stood in front of the toilet trying to urinate, only for the stream to come out weak, stop, and start, or require straining to get it out? And even after finishing, you still feel like your bladder isn't completely empty? This is one of the most common warning signs that the prostate is beginning to cause problems. Biologically speaking, the prostate sits just below the bladder and surrounds the urethra, the tube that carries urine out of the body. When a tumor begins to grow inside the prostate, it acts like a blockage in the pipe, restricting the flow of urine. At first, you might only feel a little discomfort, taking longer to urinate. But over time, the pressure builds, forcing the bladder to overwork and leaving you with the constant feeling of never being fully relieved. Many men dismiss this, assuming it's just a part of aging or a symptom of benign prostate enlargement. But the truth is, if the problem persists and gets worse, it may be an early warning sign of prostate cancer. The frightening part is that as the cancer progresses, it doesn't just strain the bladder, the kidneys are also at risk of damage from backed up urine, which can lead to infections or even reduced kidney function. Sign number 10, being unable to urinate while standing. It may sound unusual, but many men have reported that they can only urinate when sitting down. At first, they chalk it up to habit or convenience. In reality, this can signal something far more serious: an abnormally enlarged prostate or a growing tumor that's compressing almost the entire urine flow. Normally, urinating while standing is the most natural thing for men. But when the prostate enlarges and presses against the urethra, the tube that carries urine out of the body, the flow becomes blocked. At that point, the body is forced to adjust by changing position, creating extra pressure to help the urine pass. That's why you may notice it feels easier to urinate while sitting. But remember, this isn't just a random change of aging. It could be a silent signal that something abnormal is growing in the prostate. The danger is that this change often develops quietly. A man may go months, even years, before realizing he no longer urinates comfortably while standing like he used to. But once this symptom becomes noticeable, it's very likely that the prostate has already sustained concerning levels of damage. Sign number 9. Burning or painful sensation during urination or ejaculation. This is one of the most easily overlooked signals. Many men assume it's just a minor infection or dehydration, so they delay getting checked. However, if this discomfort continues, it could be an early warning that the prostate is under strain, or even that cancer cells are beginning to develop. When a tumor begins to grow in the prostate, it can cause inflammation or press against the tissues surrounding the urethra. This friction and pressure make urination or ejaculation feel painful and burning. Unlike a urinary tract infection, which often comes with fever or clears up after a few days of treatment, the burning caused by prostate cancer is persistent and stubborn. The key difference is this: the pain doesn't go away with rest or by simply drinking more water. Another troubling fact is that many men ignore this symptom out of embarrassment, choosing not to talk about it. They quietly endure the discomfort until the disease progresses to a later stage, when treatment becomes far more difficult. Sign number 8. Frequent urination at night. A good night's sleep is the foundation of health, especially after age 60. But think about it. If you're waking up 3 or 4 times every night just to use the bathroom, will your body still have the energy it needs to fight off illness the next day? Many people dismiss this as just part of getting older, but in reality, it can be an early warning sign of prostate cancer. Normally, older men may wake up once or twice during the night to urinate due to natural changes in the body. But when the frequency increases and your sleep is constantly interrupted, that's when you need to pay attention. As the prostate enlarges or a tumor develops, it presses against the bladder neck, reducing its capacity to hold urine. The result is a constant urge to go, even when the bladder isn't full. Over time, this creates a vicious cycle. Poor sleep leads to fatigue, lowered immunity, and worsening illness. Even more concerning, many men dismiss this by assuming they just drank too much water before bed. But if the problem continues for weeks or months, it's no longer normal. Studies show that frequent nighttime urination can be a silent thief of longevity. Not only is it a symptom of prostate issues, but it also triggers a cascade of other health problems: memory decline, blood pressure imbalance, and even a higher risk of falls and fractures in older adults who wake up multiple times at night. Sign number 7, unexplained weight loss. In everyday life, losing a few pounds after eating healthier or exercising more is completely normal. But if you suddenly drop weight without changing your diet or activity level, that's when you need to be especially cautious. For men over 50, unexplained weight loss can be one of the silent warning signs of advanced prostate cancer. Cancer directly affects the way your body uses energy. As a tumor grows, it steals essential nutrients, disrupting metabolism and causing rapid weight loss. On top of that, your immune system is forced to work overtime to fight off abnormal cells, burning even more energy than usual. The result? You lose weight even though your eating habits haven't changed, and you may feel more exhausted than before. The danger is that many people actually feel happy when the scale goes down, thinking, "I'm getting healthier," or "I look younger again." But the reality may be the opposite. It could be a warning that your body is silently battling a serious disease. Sign number 6, bone pain, especially in the lower back, hips, or ribs. Back pain and achy joints are common in older adults. That's why, when pain appears in the lower back, hips, or ribs, many men immediately assume it's due to arthritis, spinal degeneration, or simply just aging. But here's the concerning truth. This can also be a sign that prostate cancer has begun to spread beyond the prostate itself. Prostate cancer has a tendency to metastasize to the bones, and the lower back, hips, and ribs are often the first areas affected. When cancer cells invade the bones, they trigger inflammation, weaken bone structure, and cause deep, persistent pain. The key difference is this: cancer-related bone pain doesn't go away with rest and often gets worse over time. You may notice something unusual, a pain that isn't caused by injury, has no clear explanation, yet continues to spread and linger. Even more dangerous, once cancer spreads to the bones, it doesn't just cause pain, it also raises the risk of fractures, limits mobility, and can quickly rob a person of their independence in daily life. This is one of the clearest signs that the disease has advanced to a serious stage. Sign number 4, blood in the semen, a sensitive but important signal. For many men, noticing blood in their semen can be a confusing and embarrassing experience. Some choose to stay silent, hoping it's just temporary and will disappear on its own. But the truth is this: blood in the semen should never be taken lightly, as it may be one of the early signs of prostate cancer. This condition is called hematospermia. In some cases, it can happen due to temporary infections or minor injuries in the reproductive tract. However, when cancer develops inside the prostate, tumors can damage tiny blood vessels, causing blood to leak into the semen. What makes this even more concerning is that it often causes no pain, making it easy for men to dismiss or ignore. The bottom line is this: even if blood appears only once and then seems to go away, you should not feel relieved. If it comes back, it's a red flag that something abnormal is happening inside your body. For men over 50, the likelihood that it's related to prostate conditions, including cancer, is even higher. Instead of hiding it or feeling embarrassed, see it as an opportunity to protect your health. A simple checkup, such as a PSA blood test or a prostate ultrasound, can help uncover the real cause. Don't let hesitation rob you of the chance to catch the disease while it's still in a stage that can be managed. Sign number 3. Have you ever felt your legs suddenly become heavy, weak, or experience tingling, pins and needles, or numbness in your feet for no clear reason? Many people often blame it on sitting too long, getting older, or sciatica. But what most don't realize is that this too can sometimes be an early warning sign that prostate cancer is beginning to affect the nervous system. As prostate cancer progresses, malignant cells can spread to the spine or pelvic area. There, they put pressure on the spinal cord or nearby nerves, disrupting the signals that travel down to the lower limbs. As a result, men may begin to feel their legs becoming weaker, harder to control, or experience persistent tingling, numbness, or pins and needles sensations. The key difference with this symptom is that it usually doesn't improve with rest. On the contrary, the discomfort often becomes more noticeable over time, sometimes affecting balance, walking ability, and in severe cases, even leading to loss of bladder or bowel control. The problem is that many men dismiss these issues or mistake them for common joint or bone problems. But if these symptoms appear together with urinary changes, such as difficulty urinating, weak stream, or frequent nighttime trips to the bathroom, the chances are very high that the prostate is involved. Sign number 2, pain in the pelvic area, lower back or upper thighs. Many men over 50 often assume this is just normal wear and tear, sitting too long or moving the wrong way. But the truth is, this can be one of the key warning signs that prostate cancer is advancing. When a tumor spreads beyond the prostate, it can cause inflammation, swelling, and pressure on surrounding nerves and tissues. The result is a dull, hard-to-pinpoint pain that sometimes radiates from the pelvic region to the lower back or upper thighs. What makes this pain different is that it doesn't feel like typical joint or muscle pain. It usually doesn't improve with rest. In fact, it may worsen over time, often bringing a deep sense of heaviness and discomfort inside the body. Many men choose to take pain relievers just to get by, but this only masks the problem temporarily. If the true cause is prostate cancer, delaying attention allows the tumor to keep growing and spreading, making treatment more complex and less effective. Sign number 1, erectile dysfunction, when intimate health reflects prostate health. Erectile dysfunction, ED, is a condition many men are familiar with, especially as they move past middle age. Most often, it's blamed on stress, aging, or heart-related issues. But here's a fact that often goes unnoticed. ED can also be an early warning sign of prostate cancer. The prostate is located right next to the nerves and blood vessels that play a crucial role in maintaining an erection. When a tumor develops, it can damage or compress these structures, preventing enough blood from flowing into the penis. The result is weaker or less sustainable erections. Men may suddenly find themselves struggling with sexual performance, even if they never had this problem before. What's important to note is that it's not only the cancer itself that causes this issue. Treatments like surgery or radiation can also affect sexual function. However, when erectile dysfunction appears suddenly, especially if it's accompanied by other symptoms, such as difficulty urinating, frequent nighttime trips to the bathroom, or pelvic pain, that's when you need to be on high alert. Many men choose to stay silent out of embarrassment, but that hesitation can cause them to overlook a very important alarm bell. Erectile dysfunction isn't just a bedroom issue. It can also be the very first signal that your prostate health is in danger. Prostate cancer develops when cells in the prostate begin to grow abnormally. Normally, when a cell is damaged, the body orders it to self-destruct. But when DNA becomes altered, this mechanism stops working, and the cell continues to multiply uncontrollably, forming a tumor. This is the root of the disease, but not everyone has the same level of risk. One of the most important factors is family history. If your father or brother has had prostate cancer, your risk of developing it is doubled. This is a clear reminder that genetics play a major role, and it means you need to be extra cautious with screenings. Age is another factor that cannot be ignored. The risk rises sharply after age 50, and the majority of diagnoses occur in men 65 and older. In other words, if you are entering this stage of life, regular health checkups are not optional. They're essential. In addition, diet and lifestyle also play a significant role. Eating a lot of red meat and full-fat dairy, while consuming few vegetables, along with smoking, drinking alcohol, and lack of physical activity, all raise the risk of developing the disease. On top of that, race makes a difference. African American men have higher rates of both diagnosis and death compared to other groups. In short, having risk factors doesn't mean you're guaranteed to get prostate cancer. Think of them like small cracks in a house. If you pay attention and repair them in time, the house can still stand strong. Understanding your risks is the key to actively protecting your health. There's no way to guarantee you'll never get prostate cancer. But the good news is, you can significantly lower your risk through the choices you make every day. Think of your body as a garden. If you care for it properly, it becomes much harder for weeds to take root. One of the most important steps is maintaining a healthy weight. Obesity not only raises the risk of prostate cancer, but also makes the disease more aggressive and harder to treat. Combining a balanced diet with regular exercise is essential. Just 30 minutes of brisk walking each day, or about 150 minutes of light activity per week, can strengthen your immune system and help regulate hormones linked to prostate health. Diet also plays a critical role. Focus on vegetables, fruits, omega-3 rich fish, and tomatoes, which are packed with lycopene, a powerful antioxidant that supports prostate health. Limit red meat, processed foods, alcohol, and full-fat dairy products. Sometimes a simple fresh salad or a meal of steamed salmon can be one of the most effective preventive medicines. And most importantly, don't forget regular screenings. After age 50, or earlier if you have a family history, you should follow your doctor's recommendations for PSA blood tests, ultrasounds, or digital rectal exams. These checkups aren't complicated, but they can detect prostate cancer at an early stage when the chances of successful treatment are still very high. Finally, keep your spirit positive, manage stress, and get enough sleep. A healthy body begins with a balanced mind. As many studies have shown, a positive lifestyle not only extends life expectancy, but also greatly improves quality of life. Prostate cancer may develop silently, but with proactive choices in your meals, your daily steps, and your regular checkups, you can turn risk into an opportunity to live healthier, safer, and more confidently in your later years. We've now gone through 12 early signs of prostate cancer, signals that may seem small, but can make the difference between catching the disease in time or missing the golden window for treatment. Each one is like an alarm bell your body is sending you. The question is, will you listen in time? The most important thing to remember is this: prostate cancer is not a death sentence if it's detected early. In fact, survival and control rates are very high in the early stages. But the later it's found, the narrower the options become. That's why you should never dismiss subtle signs and never hesitate to see a doctor just because you think it's just aging. The steps you take today could be the priceless gift of life and health for yourself and your family tomorrow. If you notice yourself or someone you love experiencing one, two, or even several of these signs, take action right away. A simple checkup, whether it's a PSA test, an ultrasound, or a digital rectal exam, can either give you peace of mind or, in the worst case, catch the disease early while it's still treatable. Don't let silence or delay cost you that precious opportunity. Now, I'd love to hear from you. Have you ever experienced any of these signs? Or do you know a friend or family member who has gone through something similar? Share your story in the comments below. Who knows? Your experience may help another man recognize the warning signs early and save his life. If you found today's video helpful, please hit the like button so I know this message reached you. Don't forget to subscribe and turn on the notification bell so every week you'll receive practical, easy-to-follow health tips created especially for Americans over 60. And if you have loved ones or friends who may be at risk or concerned about prostate health, share this video with them. Sometimes one small action, one share, can truly save a life. I'll see you in the next video where we'll continue exploring nutrition, lifestyle, and daily habits that can make your senior years stronger, healthier, and happier.